Welcome to Advanced Chiropractic Solutions. This video will serve to educate you about the chiropractic alternative to pain medication and surgery. After all, suppressing pain is not a solution for a problem that isn't going to fade away. With over 13 years of experience performing over 10,000 rehabilitations in the proper health and maintenance of the spine, Dr. Mahnaz Azim is one of only 30 certified specialists in the country who can practice with a Pedibond system.
I am Dr. Mahnaz Azim, and I understand the effect that a spinal misalignment has on human health, and I'm here to educate and treat those misalignments so you can have a healthy, happy life.
This system is designed to restore the normal curves of the spine, allowing nerve signals to flow freely to all areas of the body. To begin, it's important to understand the root of back pain, where it comes from, and the role the spine plays in your nervous system.
The curvature of the neck is supposed to be like so. These discs in between are supposed to be in that curvature the way they are. If you lose this curvature in the neck, the discs are going to either bulge or herniate. The end result is there's nerve pressure. So we want to keep this curvature. The opposite direction is your mid-thoracic with 12 bones. And then we have another curvature in your low back that is similar to the one in the neck. Curvature of the neck is supposed to be anywhere between 40 to 45 degrees, and the curvature of the low back is anywhere between 30 to 35 degrees. Now, we have to have these curvatures kept in those positions for the mid-back to keep that curvature in the opposite direction. Pedibond specialists believe, and I'm one of them, that if you lose any part of this curvature, it will affect the rest of your body. Now, do remember that these nerves not only go to your neck, mid-back, and low back, they go to all the cells and tissues and organs and systems of your body. So it's not so much my neck hurts, my low back hurts, and let's fix it. It's if you want to live a happier, healthier, younger actually life. Why? Because if these discs start wearing off, guess what? They're going to take you through arthritic phases.
Let's take a look at the characteristics of the 3 arthritic phases.
If the angles we talked about, the angles of the neck and low back, if they're not kept the way they're supposed to be, your brain is not just going to take a vacation. It's going to react. Your immune system is going to react. What's going to happen is this is a normal disc, normal vertebrae, and the opening here, the nerve opening, is great. And we all know the nerve stems from the spinal cord. Phase 1 of arthritis, the outer portion of the disc is going to tear, the center portion is going to inflame, and it's going to create this bulging. This bulging is like the ice cream sandwich, actually, that you squeeze and all the ice cream comes out equally. The end result is there's some nerve pressure. If you ignore this, the body will take you through phase 2 of arthritis. Between the phases, there's a lot of time. There's a lot of warning signs in between. Acute pains, occasional pains usually starts with phase 1. And then, again, you don't take care of it the right way. The body, as I said, will take you through phase 2 of arthritis. What happens, the communication between the brain and the nervous system and the spinal cord slows down. So brain will do its own thing and the nervous system will do its own thing. Brain knows there's trauma in this area. It orders extra bone on top of a perfectly good bone here to start fusing this area because it feels there is something going on. And from here to there is a spinal fusion. This nerve is the same nerve we started with over here. However, this nerve is choking. Now, the end result of this is this nerve, as we said, just like this nerve, goes to every cell, tissue, organ, and system of your body. My job is hopefully to get you here or at the beginning of here and slow you down and stop the arthritic phases.
Let's take a look at how Dr. Azim rehabilitates and restructures the spine.
The first part of a rehab program starts with the wobble chair. It's a patent chair to work on the disc herniation and disc bulging, and it actually helps us strengthen the ligaments. And then we move them over to the thoracic roll. Thoracic roll opens the facet joints of the mid-thoracic, and by doing that, muscles relax, and second of all, those facet joints opens the circulation. It helps with the neck and it helps with the low back. Then we move them over to a machine called Link Trainer. Your spine is held by muscles starting anywhere from the calf up to your pecs. So basically we are working on the calf, the quads, the hamstrings, and the glutes. And after that, we move them over to a cervical traction unit to help nourishing the discs in your neck. After the cervical traction, I take the patient in a treating room and we utilize the Pedibond tendon ligament muscle stimulator. It feels like a deep tissue massage, but it's actually to get rid of the waste that is built up around your spine by not treating it. And after that, the patient, depending on the findings of the x-ray, gets adjusted. Adjustments are very specific here. We just don't adjust head to toe every time the patient comes in. They're very specific and they are based on the x-rays, markings that we've done. What Pedibond does is force over time. So we keep repeating the same thing over and over again to let your body know that this is the new posture and this can't be done over 1 or 2 or 3 visits. The patient wears a weighting unit mostly on their head, on their shoulder, and on their hip, again based on their x-ray finding. And after they walk around, then we put them on a unit that is called molding. When you put the gelatin in a dish, you can put it in any dish and it will form to that. So basically, the unit for spinal molding is created to mold your spine towards the curvature that it's supposed to be.
About 85% of Americans experience back pain by the age of 50. Sports, work, or automobile accident trauma are the leading causes of back pain.
If you get into an accident, what's going to happen is it will affect your ligaments, and depending on the impact of the accident, it can actually cause disc herniation and bulging. The unfortunate part is if you do surgery for no good reason, it will affect the spine above and below. So let's say there's a disc herniation or disc bulging and the doctor goes and cuts this out. The underlying cause of that problem is not gone. So basically my plea to you is don't go through surgery and don't make that decision too soon before you try everything and anything before the surgery.
After coming to Dr. Mary for, I'm going to say probably a month and a half, she gave me information and helped me with my back and my neck such that I was able to actually get rid of the numbness and tingling in my hands. So I was pretty excited because that is the way I make my living.
I came here because I had a low back and hip pain. After several time treatment with Dr. Azim, pain is gone.
If complete and permanent pain relief sounds like the path to a healthy, happy lifestyle, then you've come to the right place. Advanced Chiropractic Solutions. Chiropractic with a difference.